An economist development person with the UNDP. Kojo Sediga is going to talk to us about post-2015 when Ghana has finished with the Millennial Development Goals and whether it's met some of those goals, what we need to do as a country and indeed the rest of the developing world. All these are being spearheaded by the United Nations and its various regional offices across the world, especially in the developing countries. So we bring you that very recorded conversation. We're talking to a personality who works with the United Nations here in Accra, well, one of the UN agencies, the UNDP. But we all know about the Millennial Development Goals, and 2015 is the deadline for which all countries are expected to meet those benchmarks that have been stated out there. Issues of sanitation, provision of water, etc. More importantly, when it comes to health, under 5 mortality and maternal health mortality. How do we meet all that when we're being told we're not been doing too well in meeting these goals? And after 2015, a country like Ghana and the other aspects of the developing world, how do we make sure we keep on track and improve the livelihoods of the citizenry? We have an economic policy analyst with the UNDP in the studio, and we have Kojo Sediga. And thank you very much for joining me this morning. What's your position in the UNDP?
I'm an economic specialist.
Economic specialist?
Economic specialist.
Economic specialist. That's a very big position.
If you say so.
How long have you been working with the UN?
For 10 years now.
Oh, that's a very... I hear those who work in the UN are rich, but it's not what we'll be discussing this morning. Especially when it comes to the point where we're told that Ghana is not doing too well in meeting the MDGs. That should be a concern. Is that a concern for you as a UN office? Yeah,
it should be a concern, but I think the blanket statement that Ghana is not doing well in the MDGs it could be erroneous in the sense that Ghana is doing well in some of them. There are only 3 out of the 8 that Ghana is not doing well. They are on child health, maternal health, and sanitation.
Why?
Why I will not so much know. Because when you look at child health and maternal health, there is a lot government and other stakeholders put into that sector. But whatever we put into it, we do not see the same returns as what we put in. So that is a concern for government, for other stakeholders, including development partners as well as the UN system. And in trying to see what we could do to remove some bottlenecks from that particular system, like the health system, to ensure that we are able to achieve that particular MDG, then we introduce a framework, what we call an MDG acceleration framework. And that MDG acceleration framework is for us just to identify 3 or 4 key interventions that we can work with to be able to improve upon the lot in that particular design. So we did that as some back, I think, in 2010, 2011, which we did, and the UN led the process. The UN supported the process with the Ghana Health Service leading it, and we were able to prepare what we call the MAF for MDG 5, and that is maternal health. And in the MDG 5, we try to dovetail the MDG 4, which is child health, because we think mother and child are distinct. So neonatal care is also in it. So the government was able to attract about 52 million euros from the European Union to be able to follow the steps one after the other and be able to implement those key interventions. And those interventions are basically on emergency obstetric care, family planning, and a third one, we have cross-cutting issues in it as well. And a third one is what we call what they call EMOC, the emergency care. So And I also know that the Danish government also wanted to support it, and they tried to lend support to that particular process. So in a way, we are making an effort. For the sanitation, we did the map for sanitation as well, but unfortunately it was not able to attract any funding from either private or public sector or the DP sector. So that's where we are. But government,
we know water, etc. are critical, but not meeting maternal health and the 5 mortality and also sanitation.
Yeah.
They are the bane of our problems as far as health is concerned.
You mean water is the bane of our problem?
Well, if we have in access, it creates a lot of difficulty.
Yes, water could create difficulties. Not alone, not only in health issues. Even you can relate to productivity as well, because if you spend more time to get water,
definitely,
it affects your productivity.
Definitely.
But as far as the statistics says, I think water we have improved a lot. I think water coverage now is about 66% countrywide, and that is safe water, which it's from Ghana Water Company and from some boreholes in some communities that are safe, supported by some NGOs, supported by development partners, and as well as government itself. So that we are on
Why
track.
as a country haven't we been doing too well? And now you're telling us not only with sanitation, maternal health or maternal mortality as well as under 5 mortality.
Why we are not doing well, there is always an issue with policy implementation. That's the way I say it. That you may have a good intention for policy, but you might also take into cognizance some issues relating to how that policy is implemented, and even how the policy is even also evolve. They are all critical issues. And in public policy, you will want to see whether the policy has equity. Equity is very important as you do policy. So to start with, you realize that in the Ghana Health Service or Ministry of Health, the budget, almost about 90% goes to salaries and administration. Okay, so what is left to leverage on for investment and other services that will enhance the health of our mothers? So that's the question. So probably when we were cutting the policy for that, then we need to look at it. Ghana has a very rich policy as far as maternal health is concerned. When we were doing the math, we reviewed about 50-something documents that Ghana has, various ones that has something to do with maternal health. So that should also tell you that fragmentation of policies and programs can also hinder progress. So if we have today, you want to have something for maternal health, you put it, I remember in 2008 or 2009 when we declared as an emergency, then as a country, then we say all mothers should attend health, or pregnant mothers should attend health care in government facilities free. A very good policy. But the issue is that, is it an integrated policy? Those are issues. And so you want to see whether that policy is aligned with all other existing structures within the system and whether they fit into it. We might want to say, okay, national health care, this is a good policy, and it must do well to ensure that we have good health system in Ghana. But if you do not integrate all other aspects of it into the list, you might miss the boat. So the policy formulation itself and how that translates into implementation has all problems. Somebody who is implementing may not even understand what are the underlying factors of the policy making. So there could be disjoint along the way, and you'll find out that when you look at budget, when you look at efforts we make, you realize that a lot of efforts are going into things, but so long as they are not integrated, there is no fall through it, we can have those challenges here.
Now, in trying to make sure that post 2015, we still make sure we have a certain focus and try to manage some of these difficulties for which, if we had, we would have met some of these goals. What then is a policy or the mindset now from on the part of the UN?
Now, the whole agenda is that every policy has a lifespan, and therefore every program will have a lifespan. We have the MDGs from 2000 to 2015, that is 15 years, that we should be able to achieve it. And the question I keep asking is that whether we achieve or we do not achieve, should we stop at that point and say, well, we try our best, we did not achieve, or we stop and clap for ourselves that, well, we have achieved it, hooray, and should we stop? No, life continues. And development is a process. So long as we have a milestone to achieve, and 2015 is coming, whether we achieve or we do not achieve, we need to look forward again. So for the next 15 years, the next 20, 30 years, what else do we do? What do we do differently this time, and how do we? So you need to review what you have done so far for the past 13 years or 12 years and say, okay, so the next 15 years, this is what I've. So that is the whole agenda that is bringing about the post-2015 development agenda. And in doing this time is differently done. You remember that the MDGs, they were actually declared in 2000 by 189 governments globally at the UN headquarters in New York. So, but this time, the post-2015, we keep thinking that probably maybe there are certain things that we did wrong. So this time we started from the grassroots. Then that's why we ask people, what's the future you want? Okay, so we begin to ask the question, what future do you want? Then they will tell you health. If you want health, how do you want it? So you say, I want that the mothers should not die when they are pregnant to the point of delivery. The kids should grow up to ensure that they attend their 20 plus and grow as adults. So people will say all sorts of things. So you gather it, now you begin to synthesize what you have and look through it and see, okay, these are the things that are ramming through. Then we need to do this, and after your tallying and this sort of things. So that's what we're doing. And we did that at the local level. You move to the national level, even at regional level, where countries also come together. We discuss this thing. Yeah. And
in going forward and trying to, well, evolve this whole idea and make sure its implementation comes into fruition, you need to work with the structures, same structures, the state agencies and the NGOs, etc., that you work with, same stakeholdership?
Yeah, structures will always be same. That is the hardware, it will always be there. But we need to change the software. Okay, that's why I think that we need to change the software. The way we do things, we need to change it. For the structures, they are there to support whatever we do. If you have a Ghana Health Services, it is for that particular institution to deliver service, health services. Okay, so you cannot take it away that, okay, we've worked with this for now, let's take them off. If you take them off, what else? You need somebody to do that. So that institution exists, but maybe what we need to do is to look at it, what were we doing wrongly or doing rightly, that we learn from them and improve upon them. Those that we're doing wrongly, how do we correct them and ensure that we do them better? Okay, so for me, that's the way we look at things. And you do not just sweep everything that, well, I have not performed, let me sweep it off and bring new things all together. Then you are starting afresh. Since development is a process, you build on what you have and continue to build as you go along.
Once we have done evaluation and seeing that perhaps if it's a subject of a policy gap, also because of a lack of infrastructure, and if there are budgetary issues, how then do we make sure, well, we better the system now, making sure we have the corrective measures in place, and this time we get it right?
Yeah, we call it we call it localization of the post-2015 development agenda. So what we basically saying is that, how do we ensure that the development agendas are implemented from national level down to the local level? Okay, so with that chain, we need to know. So we want to know the process that we can use, the mechanisms that we can use, the reporting systems and the monitoring systems that we can use to achieve that particular agenda. Those we will discuss it and ensure that at the national level, how do we do it? And maybe local level, and maybe even a sub-local. Earlier on, we asked the district assemblies, where they call the DCUs, the planning units, about 7 from each district. We asked them that question. So we asked all the 247 districts these questions, what we do. And after this workshop tomorrow, we have the opportunity again to go to communities and ask them that you said the other time you want health. How do you want that health to be implemented at your level? So we will take this and synthesize all these reports into one report sent to your UN headquarters, which eventually feed into, by September, will feed into the Secretary General's report that will present to the General Assembly of countries. And they said, we think that we need to do things differently this time, and this is the way people think we should do it. And so at that point, then policy formulators will take it and see how they formulate it into a policy, and eventually by 2015, September, October, thereabout, then we can have a new development agenda for the next 15 years.
So will I be right in saying we're in the preparatory stage?
Yes, we're still in preparatory stage. We're still in preparatory stage. We have actually finished with the what. The what was what we did from 2012 to 2013. Then we're asking the what question: what do you want? What feature do you want? What feature do you want? Are
we looking at any time frames? For example, I know for the Millennial Development Goals from 2000 to 2015, that was a time frame. Yeah. Now, post 2015, well, it's not going to be tagged any UN Millennial Development Agenda. Now, what then are we looking at? What timelines are we looking at?
We're also looking at the next 15 years again. So we
keep going 15 years and we never achieve, then we keep going 15 years.
It's not that we keep going 15 years, we never achieve. We have achieved something. There are countries, even our own Ghana, we achieved some things. Over the years, let's bear in mind, we use 1990 as a benchmark for the targets. Okay, so over the years, our poverty level has reduced. Some people say they doubt it, and I asked the question that if you say you doubt it, if you can give me a good example that at first if you are eating, let's say, a raw kenke and you add fish to it, it's an improvement. Yeah. So, but people probably want to see that maybe I'm a teacher, I have a 1-bedroom.
So I'm having
3-bedroom, so my poverty level has increased. It's not
one drastic change.
Poverty, it doesn't work that way. But we have improved in poverty very drastically, and also education-wise, education outcomes were very good. HIV issues were very good. As far back in 10 years ago, HIV was a hot issue, and maybe young guys and girls now, when you ask them about HIV, they'll tell you HIV, because then the social marketing was very strong, and people, because we thought that we are already 3%, so now that we are 1.2%,
nobody really minds.
So complacency is even entering. So that's one thing. So we have achieved something, and other countries which we thought that they have also, when you look at their MDG reports, they have also improved somehow, and therefore there is the need to keep the momentum, there is the need to keep focus, there is the need to be determined to be a better person.
For the UN bodies, or let's say the other UN agencies that work with you, and the UN system now wanting whatever developmental effort to be very much participatory, involving the citizenry, it means that something might have been wrong with the parastatals or the
not necessarily
the duty bearers or let's say the state.
Not necessarily the case. I think it's a paradigm shift in approach to development. This has been with us for some time now, where we say development should be participatory, that ask people what they want. Do not give them what you think they want. Probably the person doesn't want it. And if you think the person wants it, you must be able to engage that person. Explain it to the person. That, look, yes, you want Gary, but I think rice is the best thing you want. And I think when you take rice, these are the things, the qualities you have. When you take Gary, these are the qualities you have, these are the advantages and the design. The rice, these are the advantages that the person will make a choice, yes, knowing that I think we want this. And you move on as a country or as people. And I think that is what the participatory...
So how are you going to name the next phase? MDG 2?
We do not have a name for it yet. We still call it Post-20 Development Agenda because it's still an agenda we're pursuing. Maybe the countries, when they meet at the General Assembly, they will give it a name. And mind you, we keep saying the UN, but the UN is made up of countries. So whatever we do,
so basically the UN is us.
It's us, yes. The UN is us.
Okay.
And when you see the charter, I say, we, the people of the United Nations. So it's the people, the UN, that's why we want to involve the people, not only the government of a particular country. We will involve the people, the stakeholders, all the stakeholders, to make a decision on what we really wanted to do for ourselves.
I remember 5 years ago, the alarm bells were sounding.
Yeah.
Well, we were not going to meet some of the goals, and some of them critical goals.
Yeah.
If the signs had been on the wall, perhaps supervision had also been poor, just like commitment and implementation.
Yeah, the signs were on the wall, and I think that's what I told you earlier, that, excuse me, that's what I told you, that actually brought us to the thinking of doing the MDG acceleration framework. That because we realized that, look, not every country will achieve these MDGs, and they are able to achieve some they are not able to achieve. Then can we take a look at those particular ones and see why they are not achieving them? And when we pick one, things that are working, we do not touch them. They are already working. So things that are not working are the things we need to look at. Okay, so we look at them and say, okay, these are not working within that particular list. So those are the ones we concentrate on and mobilize human and financial resources around it and see how best we achieve upon it. Yeah. While
we look at post-2015, after now the program has come to a close, or the whole agenda has come to a close, MDGs, how do we make sure the ones that respective countries perhaps have met benchmarks or targets, there's no relapse?
I think that is, for me to say it, is that it's not necessarily coming to a close. That's what I said. Development is a process.
Well, I know it's a process.
Yeah.
How do we make sure that key performance indicators we don't relapse in achieving some of them? That's all.
Why we cannot relapse in it? I think the way to go is this: that this MDG dovetail into the post-2015 development agenda. And I can tell you that when you pick the issues that people think they want, when you pick the issues that people think they want, you will find in it, certain agenda and targets that were in the MDGs. Almost all of them are still in the 2015 development agenda. They were in there, and even additions now. You remember the MDGs had nothing on governance, but now we have things on governance in the decision as people want. So we have them, and so therefore it will not be that, well, let's drop this and pick that. It is one dovetailing into the other, and so that we have a seamless development process. So we should not be leaving anything behind and be complacent. So that's the next phase of the development. Yes. How do you make sure you carry the countries along with you, or, well, they have no choice? Countries have always been carried along, and I think every General Assembly, countries go to report on the MDGs, and I think days that I am witness to, from days of President Kufuor, President Atamez, and President Mahama, each year they go to the General Assembly and I give account of what their country is doing on the MDGs. Apart from that, there is always an MDG report that we do biannually to see what the situations are. And this in Ghana is done by the National Development Planning Commission, NDPC. So they do it annually to see what the progress we're doing. And in that way, that alone serves as a peer review system, that you will go and talk about your own. You said, I do not achieve that, I don't achieve it. Well, people are saying, I have achieved that. And remind you, it is carried by the press globally. Okay, so that alone is an incentive for you to do something. And I think globally, every country is serious wanting to do something, apart from countries that are involved in war. And even in war, they are struggling to do something. Yeah.
Okay, so for the UN system now, you're going to have this very workshop, and then as a head start, you're going to do collation of consensus or views?
Yeah, basically is to reach a consensus on what exactly, how we are going to implement this development agenda, so that as soon as we take off, we know what we're going to do. Remember, the MDGs, they were sent to the countries that were, these are 8 development goals with the targets. I think then it was 28 targets, they expanded later, and some 48 indicators. You must ensure that you implement them. Okay, so but this time, by the time we say go, we must know how we are going to implement this development agenda. So that is the process in which we are engaged now, that we must seek the aspiration of everybody, the ideas of everybody, the hope of everybody, to see how we implement this and ensure that it is done. And as usual, we will do this with the main key resources that we always use in implementing programs and policies. Yeah.
So who is represented in terms of which categories of people at the developmental level are represented? The chiefs, the district assembly?
Yes, I will say I think almost everybody is there. We have the media there. We have government as the MDAs. They are there. We have other parastatals. We have chiefs. We have the district assemblies. We have professional bodies. We even have NGOs, and also have vulnerable groups that we have. We invited the vulnerable groups as well. And from there, we'll go to the even communities to ask questions. So we are certain that everybody that is concerned in this country is brought on board to make a decision.
I wish you all the best, sir. We hope to have you sometime again in the studio for us to do a lot more discussions on Ghana's developmental efforts. And post 2015, what do we do with the rest of the MDGs that as a country we've not been able to achieve? That is what the UN system in Ghana is now thinking about, and leading the discussions is the UNDP. We've had its economist specialist in the studio, Kojo Sedegan, who has been giving us an insight into a workshop that is going to be convened, and then they collate a lot of views, and those views also will be mainstream into not only a document, but what the idea will be presented to the UN General Assembly or the UN system in itself. Then we have a certain pattern of development post 2015, that is after we've not been able to meet the Millennial Development Goals. Thanks for again watching. We have a lot more for you up next.